When assessing body composition through Skinfold measurements, remember that all measurements should be made on the right side of the body with the subject standing upright. You want to identify and mark all sites before measuring. Once all sites are marked and you're ready to begin taking measurements, you want to firmly grasp the Skinfold between the thumb and index finger of your left hand, 1 centimeter above the site that is to be measured. The caliper should be placed directly on the skin surface 1 centimeter away from the thumb and finger, perpendicular to the Skinfold. The pinch should be maintained while reading the caliper, and you want to wait 1 to 2 seconds before reading the caliper. Duplicate measures are taken at each site, and you should retest if duplicate measurements are not within 1 to 2 centimeters. You also want to rotate through measurement sites or allow time for skin to regain normal texture and thickness. There are 7 Skinfold sites that will be measured: the triceps, subscapular, the chest, the mid-axillary, abdominal, suprailiac, and the thigh. The triceps site is located halfway between the acromion and olecranon processes. The subscapular site is located 1 to 2 centimeters below the inferior angle of the scapula. The chest site is 1/2 the distance between the anterior axillary line and the nipple for men, or 1/3 of the distance between the anterior axillary line and the nipple for women. The mid-axillary site is on the mid-axillary line at the level of the xiphoid process of the sternum. The abdominal site is 2 centimeters to the right side of the umbilicus. The suprailiac site is in line with the natural angle of the iliac crest, taken in the anterior axillary line immediately superior to the iliac crest. And the thigh site is located midway between the proximal border of the patella and the inguinal crease. Now that all sites have been marked, it's time to begin measuring. The triceps site is a vertical fold. The subscapular site is a diagonal fold. The chest site is a diagonal fold. The mid-axillary is a vertical fold. The abdominal site is a vertical fold. The suprailiac is a diagonal fold. And the thigh is a vertical fold. The following equations are the most common and generally used equations for determining body density and body fat percentage in both men and women.